In spite of the fact that radiology has brought on some of the greatest medical advancements in history, and has continually saved countless lives every single year, there is a lot of concern about radiology. Of course, this is natural, given the fact that there are risks involved in radiology, as excess exposure can lead to radiation poisoning and increase the risks of a number of different diseases, cancer among them. But currently, there is a new approach being studied that will greatly reduce the risk of radiation exposure. This approach entails boosting the protein pathway in the body's blood-making system to protect from radiation poisoning, all the way up to a level of radiation exposure that would otherwise be lethal. This, in turn, will open the potential for new treatments against radiation toxicity during cancer treatment. The core of this study revolves around the function of the THP-DAPC pathway in radiation mitigation, and while this pathway is normally noted for the ability it has to prevent blood clots from occurring and to help the body fight off infections, researchers are beginning to uncover the manner in which this pathway also helps blood cells in bone marrow quickly recover from injury that has occurred as a result of exposure to radiation. Although the research in this area is still in the preliminary stages, with a long way to go until anything definitive or fully applicable is achieved, early results show that by pharmacologically boosting the pathway with 2 different drugs for treatment of thrombosis or infection, doctors will be able to effectively accomplish the task in question. That is, preventing death from even lethal doses of radiation. This is accomplished by both accelerating recovery of hematopoietic progenitor cell activity in the bone marrow, and by reducing the overall effects of lethal total body irradiation. In fact, even accomplishing this in tests when treatment was delayed for up to 24 hours. Of course, should this research hold up, the benefits will be far-reaching, as greater levels of radiation will be able to safely be applied in instances where the situation calls for such a course of action, and standard levels of radiation can be applied without the currently inherent risk. And once the early lab research progresses to a place where they can identify the additional cells or molecules in the body that help in this process, we as a community will be one step closer to risk-free radiation exposure, and to greatly improved health.